the station that's on your side. This is Channel 7 News Daybreak.
6:23 with school back in full swing. We've had a lot of reminders about vaccinations. Well, we want to tell you, did you know that there is a vaccine for shingles? Joining us this morning to explain is Baptist Health Dr. Devon Ballard with Sherwood Family Medical Center. And let's start with explaining shingles this morning. Good morning, Dr. Ballard.
So shingles is in essence a recurrence of the chicken pox. So everybody gets the chicken pox usually when they're kids, or they get the vaccine as a child for varicella. And so at some point in time, when you get that, it lives dormant in either your brain or spinal cord, and it might come out, it might not. And so I've had a lot of people that have said, oh, I've never had the chicken pox. And I was like, I bet you have. So we can actually do a blood test to test for it. Yes, and 99% of people have had it. They just don't remember it. They had it as a child, etc. But it's not fun when it happens.
Symptoms of this. It's like the chicken pox you said, but it'd be very painful. Correct.
So usually there'll be, it only comes in a certain, what I call dermatome, or a certain area of the body, and it usually never crosses the midline. Okay. And it usually will cause pain on a side, or side of the face, or side of the leg. And then it could be it's been more painful enough that actually I've had to get, I thought somebody had blown a disc and had to get an MRI, and then it was normal, and 2 days later, oh, I have this rash. So the pain precedes the rash, and then there'll be a rash in the area of the pain, little blister, vesicles, red, very painful, and it's, when you look at it, like, oh, you got shingles, and so we know how to treat it. So.
Yeah, it's pretty spot on when you see something like that, what it could be. I see some of these symptoms. I mean, red rash you mentioned, but the blisters, the fever, headache, sensitivity to light and fatigue. I mean, these are a lot of different things in
Correct.
one thing.
Usually even a shirt, if it's on their side, even the shirt touching you will be uncomfortable.
Really?
But there is treatment. There's medicine to treat it when it happens. There's also a vaccine. There was one vaccine initially that had come out years ago called Zostavax. Okay. Now a new vaccine has come out called Shingrix. Shingrix is about 90% effective versus Zostavax was 60+%, so it's more effective to prevent it. Yeah. It's a 2-shot series. Usually get 1 shot, and then after 2 to 6 months you get the other booster shot starting at age 50 and above. Because it's more likely to happen over the age of 50 to 60. It can happen at 18, 25, 30, sometimes associated with some type of stress. It could be emotional stress. It could be a physical stress, like I broke my leg or I got a bad sunburn. There's usually something preceding either physical or emotional stress that can sometimes precede that.
Wow. So shingles is like the pile-on virus. Correct. Something bad happens to you, and it just piles on.
Correct.
Yes. Okay. Wonderful. That's just lovely. To get the vaccine, you mentioned for folks over 50, but is it something for kids too?
No.
Okay.
Not for kids. Kids. So you don't see as many cases of chicken pox. So there's a varicella vaccine that's given to kids as part of the routine schedule when they're young.
Okay, wonderful. Thank you, Dr. Ballard, for coming in. You can always contact Baptist Health at the number on your screen.